Well, there's been some good news, as we just said, for the Western Cape's grim COVID-19 situation. Infection rates in the province have shown signs of decline over the last 7 days. That's according to a new virtual update by the province's health leaders today. Dr. Keith Cloete is the HOD in the Department of Health in the Western Cape. He joins us now. Doctor, thanks very much indeed for your time. Before we get into the actual infection rates, it's interesting that the number of trauma cases in the province's hospitals are down, no doubt possibly due to the alcohol prohibitions. Of course, that just creates more space in hospitals, doesn't it?
Good evening, Devan. Good evening to the viewers. Yes, we are very glad to report that our experience over the New Year's Eve and New Year's Day and the weekend following has been the quietest weekend from a trauma perspective, and mainly due to the restriction of alcohol and then also obviously the restriction of movement due to the curfew. But our hospitals, and we track the data, have shown at least a 60% decline week on week between Boxing Day and New Year's Day. And on average, that was the peak on Boxing Day, and the peak at New Year's Day was 60% less cases in our hospitals. And then just on average, if you compare this past weekend with the weekend of the year before, it was more than 65% quieter than the New Year's Eve weekend of a past year.
The other good showing in that presentation today was the fact that the Garden Route, which was of serious concern as a hotspot, has now reported fewer positive cases in the district. But one wonders whether it's just not due to the fact that fewer people have been tested.
So one of the things that we do guard against is to make two quick pronouncements based on the fact that we've had 2 long weekends and where testing was restricted. But the pattern in Garden Route is not only the cases, it is also the hospitalization. So the level of hospitalization has dropped. And then a very important marker, which is something called test positivity rate. It's the number of laboratory specimens you sent and what proportion of them come back positive. Now, whether you take small numbers or big numbers, that is quite an accurate reflection. Now, on all 3 of those markers, together with deaths, there's been a steady decline in Garden Route over the last 14 days. So we're confidently saying that we've seen the stabilization and actual decline out of the second wave for Garden Route.
Doctor, something else mentioned in the briefing today was what you call reproductive rate. And you say that's declining, where each positive case starts to create another case, less likely in this particular case. But one just has to be mindful of the fact that any bit of complacency might change that, wouldn't it?
Absolutely. So the reproductive number is an internationally used figure, Devan, and it is an indication for every positive case how many other people you are infecting. So when you are on a very steep incline, like we were on the 10th of December, we were in a very steep incline. For every case, there was 1.5 other people that were infected. That means your case is incline. What we've seen steadily since then, by looking at cases, deaths and hospitalization, we are approximating for the whole province a reproductive number of 1, which means it's one person infecting another person. Now, the way the COVID epidemics work, and that's what have happened in the Eastern Cape and what's happened in Garden Route, when your reproductive number drops below 1, that means for every case you have, you infect less than 1 person. That's when you see a decline in cases. But we are absolutely keeping vigilance to make sure that at any given time you can have an outbreak, any given time you can have a spike in cases, and it takes you back into an acceleration of cases. So we're not at all preaching for complacency, actually the opposite. This is exactly the time where we must be more vigilant to adhere to social distancing, masking, and really just avoiding crowding and avoiding other people, because that is what will help us to bring the transmission rate down across the whole of the Western Cape, not just in Garden Route.
What do you say to those that might use some of the info to, bolster their case for the opening of or easing of certain restrictions in the province?
At the moment, Devan, these restrictions that we have in place has helped us in twofold. The first one is you rightfully noticed that the reduction of alcohol-related trauma given breathing space for the healthcare system just to be able to cope with the COVID cases. But the second reason why the restrictions are helping us is also to curb the transmission of COVID. And that is a very important thing to remember. We feel that these restrictions are assisting us currently, and we can see the downward trajectory in Garden Route. We would like to see that downward trajectory in the Cape Metro. It seems that we are heading towards that during this coming week, and then in the other districts as well. So for us, the current restrictions as they stand has been very important for the healthcare system in the Western Cape to be able to cope with what's coming at us, and also to ease out of the transmission towards a place where we can recover as a healthcare system.
Doc, before I let you go, you mentioned this in the briefing as well today. What's your position on the COVID vaccine at the moment? Where does your province stand?
Yeah, our position is a clear one. Our primary aim is to make sure that, like everyone else in the country would like to see, we would like to have access to vaccines for the people in the Western Cape, and in the same priority categories. Firstly, healthcare workers and other essential workers, then vulnerable people, the elderly, and people with comorbidities. We would like to have access to the vaccine as practically soon and as soon as possible. We are gearing up our, let's call it our infrastructure and our mechanism to be able to administer the vaccine. So the delivery of the vaccine, to be able to get the vaccine in the country and for us to have access to it becomes a key priority for us. So that is what we are currently working with. There has been some national guidelines that's come out, but the province is taking a very proactive stance to say whatever we need to do to be able to get access to vaccines, we want to explore all the options to be able to do that.
Yeah, and just one more thing, if I can throw in, I'm wondering what your position is on the police commissioner, or the Keith Cloete coming through to the province today and over the past few days, taking quite a firm stand, necessary or not?
I think the police commissioner is here to observe what needs to be done in terms of the current regulations. The South African Police Service has been working with all our law enforcement agencies in the province, and everybody is taking a stance in terms of the current regulations. So we are very much for, and our disaster management system and law enforcement officers have been working very hard to see that there are adherence to the current regulations as they stand.
All right, we'll leave it there. Dr. Cloete, thanks very much indeed for your time. That's the Western Cape Health Department's HOD, Dr. Keith Cloete.